Good evening, everyone. My name is Mela. I am the Communications and Member Manager with Rare Diseases South Africa. I'm here joined by the ever so amazing Lorraine from South African National Blood Services. So she's going to be presenting to us, giving us education about blood donation and other components or elements that we can donate. Sorry. Lorraine, can you just kindly introduce yourself and take it away?
Oh, thank you, Mela. So I am Lorraine Malapasani. I'm the educator for the blood service. So I hear that you guys do some amazing job work. So yes, so late, guys. Why are you guys so late? Like, what is your hours?
Always on the clock. Yeah, always
Oh,
on the
okay.
clock.
Yeah, because when I said, you guys, I have a 5 o'clock or a 7, they're like, huh? I'm like, yes. But anyway, it doesn't matter. We are here now. So I'm going to speak about the different components that we have or that a person can donate. And then you guys would obviously decide what you would like to do, whether you would like to just donate normal blood or other components. So let us start. So the presentation obviously is on the various blood components that we have. So did you guys know that you can actually save 3 lives with 1 unit of blood? So the products that we have is obviously the different components, which is like your red blood cells, plasma, platelets. So when you go through to donate blood, you can actually donate either a whole blood unit as it is, which is 450 milliliters of blood, or you can donate plasma, or you can just donate platelets. Now, these products, they also have expiry dates, and that's why it's important for somebody to, when he or she decides that he wants to donate blood, make it a regular basis. So when you want to donate blood, you are obviously going to do it every 2 months. Your plasma or platelets, you can donate every 2 weeks. So the red blood cells we can keep for 42 days, the plasma for 1 year, and your platelets, we only keep it for 5 days before it expires. So let's first discuss the whole blood unit, which is the 450 that you're going to donate. So it's the normal, as we all know, the blood that flows through our bodies, which is not separated into different components, which is the mobile units that will come out to either the shopping centers or your organizations, schools, and so forth, where you can go through and just donate blood. A whole blood unit can also then be divided into the 3 products, which can make which is easier for them to use the unit of blood to save up to more lives, to save our patients. And a whole unit of blood, obviously they use it for normal surgery or during trauma or childbirth. No, that is what a whole unit of blood or just the red blood cells will be used for. So the plasma is a liquid part of your blood, which the red blood cells, white blood cells, and platelets are suspended. It makes up to 55% of the total of blood volume. Now, a plasma, you can actually go through and donate blood, donate it at any of our donor centers, which is also for platelets. You don't need to do a pre-test for plasma because they just they're not going to take the rest of your blood, like they're not going to take your red blood cells or the platelets. They're just going to take the platelets, the plasma. So the platelets and the plasma is similar, that you donated the similar way, but let's quickly discuss. The platelets is obviously a small colorless cell fragment circulation in the blood, and these ones that you guys know, we use it to stop bleeding. So the criteria for the whole blood and the plasma and platelets is slightly different. So let's start with the whole blood unit. So the criteria is the age from 16 up to 75. And all first-time donors, people that have never donated blood, must come with proof of identification so that they can be registered. The person also then needs to weigh 50 kilos and more, must be in good health, and lead a safe sexual lifestyle. And the person must consider his or her blood safe without even being tested. And very importantly for us, the person must commit to become a regular blood donor. Because what happens is when you donate blood a first, second, or third time, they don't use your plasma. They will, or they don't use the red blood cells. They won't use any of your products until you come back. So you donate blood for the very first time today. Then we test the blood, it's safe. Then they will keep the plasma back. Remember in my first words, I said the plasma we can keep for up to 12 months. So when the person comes back in 2 months or 3 months later, they'll test the blood again, see that it's still safe, then they will use the plasma from the first unit. So they do that for 3 to 4 times to make sure that this person is committed and that his blood is safe. Now, every single time somebody donates blood, the blood does get tested. It doesn't matter even if you've donated over 100 times. But it's important, the more you donate, the more they can use other products of your blood. So with a whole unit of blood, they can also separate the blood and then give the plasma for it to be used or the platelets to be used. But then it will mean that 5 different plasmas or platelets will be used on one donor. But if you go and consider to donate platelets or plasma, then only, let's say, Mel, you decide that you want to become a platelet donor, then they will use your platelet for one specific person. So the criteria for the plasma and the platelets. So you also need to be healthy. You also need to be a safe donor, but the weight is 55 because it takes longer to donate platelets and plasma, and it's taxing on the body. Unlike when you donate whole blood, where it takes like 5 to 10 minutes. This takes about almost an hour. So that's why they say you need to weigh 55. The age is also slightly different. So you start from 18 up to 65. Whereas with whole blood, it starts from 16 up to 75. You also need to be in good health. But now, for platelets, you're not allowed to take any aspirin for 7 days before you're going to donate, or any anti-inflammatories 3 days prior to that. Now, when you want to become a plasma donor, you can, let's say you went to a malaria area and you are a whole blood donor. On that day, if your time period for malaria is not up yet, then you can decide, okay, I can't donate whole blood today, but I will then donate plasma. And because you don't need to do a pre-test for plasma, nobody needs to check and make sure that your plasma count is enough. You don't need that. So you can then just go through and donate plasma. But with platelets, we need to do a full blood count first before you decide that you would like to become a platelet donor, because we need to make sure that you are safe. We also need to make sure that you have enough platelets in your body for us to take from you. Then we're looking for people with the blood type A or AB, or people that struggles with iron levels, so that we can, because remember, when you become a platelet or a plasma donor, we don't take any of your red blood cells. So what they would then do is they'll put the needle in, but the tubing of the bag that you're going to bleed in is attached to a machine. So this machine will then separate the blood inside, and then it will keep either the plasma or the platelets back, and then the rest of your blood will come back to you in one needle. So that's why it takes a little bit longer for you to become or to donate plasma or platelets. Are we still together?
Yes.
Okay.
I'm following. We have a question, but we'll answer
Ask-
all the questions later.
Oh, okay. All right. So as I said, with platelets and plasma, you can donate blood every 14 days because we don't take all your blood, as in your red blood cells and all of that. We only take either platelets or plasma. So you can donate every 14 days, 24 times a year. And it takes longer. It takes like 45 minutes or more. Then with whole blood, you can donate every 56 days. And you just need to give yourself at least 30 minutes because remember, they still have to register you, check the iron level, the blood pressure, and the donating of the blood takes about 10 minutes. So we just say, give yourself extra time so that we can make sure that you are 100%. So both processes are similar. So you also need to come with proof of identification. You will then be required to complete a digital donor questionnaire, and we will do a one-on-one confidential interview. So in the one-on-one confidential interview, the sister will then discuss with you how you've answered all the questions. If there was any yeses or medications, then that's where you guys will then discuss it. They will also then check the blood pressure because remember your blood pressure and your iron level needs to be okay if you want to become a whole blood donor, and we need to make sure that you are okay. Then, like I said, for the platelets, we will do a full blood count before they take platelets from you. So if they do the full blood count today, let's say 2 days later, they will let you know, okay, this was the platelet count, everything is fine. Then you will set up an appointment. For platelets, you need to set up an appointment so that they make sure that there is enough machines because each of our donor centers only have about I think about 4 machines in it. So that you don't want to go there and have to sit and wait for somebody to finish before they can help you. And then all the blood gets tested, whether you donate platelets, whether you donate plasma or whole blood. So we test for HIV 1 and 2, hepatitis B and C, syphilis, and your blood group. These are the standard tests, all tests that we do every single time somebody donates blood. Then this is just a nice compatibility chart to show you who, which blood group goes with what, or like we all know, blood group O negative is our universal blood donor. So that blood type can help all the blood types, and just something nice for you to have and see, okay, if I'm an O positive, I can help all the positive blood types. Yeah. And then I wanted to share just a story with you guys of Christian, so that you can see what actually this the how the machine look, and because he donates platelets and plasma.
So I'm Christian de Pre. I've been donating blood for almost 13 years. Um, my mother needed platelets or plasma. I can't remember what it was. And then yeah, since then, I think it was 2005, 2006. I was kind of already involved with the blood family.
I've been with Christian since his 16th birthday, since he starts donating in Hatfield. When he comes in, it's just a pleasure. One of those donors that have little needs, but he knows that he can make such a huge difference.
Yeah, I'm just very grateful because it meant that my mother can become better. I know with platelets they use it in cancer treatments as well. I've got a couple of family members and friends who also had cancer. So I would just encourage everyone to come and donate. Donating blood takes 30 minutes, it's not that long. Blood is very crucial. I mean, it's from anything from being in a car accident to having cancer.
We've been through all his milestones. It's like a child for me. And when he comes in, we have just that special relationship with him.
Yeah, so I'm very grateful for the organization, the South African National Blood Service. It's done quite a lot in the many years it's been active. It saved a lot of lives.
My name is Mlungisi Peter Mahlangu, and I am a regular blood donor for SANBS. And I guess I started donating back in high school. I've been in a situation where I've seen my family members needing blood, and luckily enough, like they got a chance to receive blood. So it made me wonder and think that if someone else could do that for a member of my family, of which it's someone they do not know, why would it stop me from helping someone else? So from that point on, I started donating on a regular basis. So started with blood and shifted to platelet after. I once witnessed my mother donate blood, and it wasn't too many times. It was just twice. It was a mall. We were walking by, and then she held my hand. We walked in, and I watched as they stuck the needle and the bags, everything. And I asked, like, why do you do it? You know, and she told me, like, you need to cherish life. You know, there's always something you can do to save someone's life, and that stuck with me. I need to highlight on, like, in 2020, I lost my mother. So for that year, yeah, it was a tough year. It was after I lost my mother that I didn't come for a few donations. And when I finally came, they asked me, like, what's going on? And I explained what happened, you know. And at that point in time, yo, I cried. Yo, I really cried. And you know, I feel like if like everything stopped, they cared. You know, it really felt like they cared. They gave me hugs. They made me tea. Yeah, like it was a tough time. So for like what they did to me then, it really wasn't much, but to me it was something big, and that is why I keep on coming here. As much as I do not know whose life I am saving, but I would like to write on the fact that like it's worth it. You know, it's really worth it, and um, it's something I would wanna pass on to my nephew or niece if ever they feel they are able to do it. Because I mean, it doesn't take much. It really doesn't.
So yes, guys, that is just a short story of two of our donors that actually donates platelets and plasma. Is there any questions that you guys have? Maybe we can just go in it now.
There's a question on the chat. Questions actually. Eleni says, why is it that you cannot take anti-inflammatories before donating?
It's not for whole blood. It's just, sorry? Hello?
Hi, Lori.
Oh, yes, the anti-inflammatory is also just, there's a reason why somebody takes anti-inflammatory. Probably you have pain or it's swelling or something, but it's just for the platelets that they will ask you not to donate when you've taken anti-inflammatories. If you donate normal whole blood, as long as you don't have any pain on the day, you can. The only thing that we don't allow you to donate whole blood is if you're taking antibiotics.
Okay.
Can I ask a
And then the
question?
next
Yes, ma'am.
question. Sorry, you can go on.
I'm Urieta Jalbert. I am a patient that is in my 5th year of receiving IVIG polygam every month. So I'm a professional nursing sister that had to stop work because of my immune deficiency due to a herpes virus. So I just want to say thank you for everyone that giving blood, because I get 9 bottles of polygam every month, and that is 9,000 people's healthy antibodies that I get. So for me, blood is my lifeline at the moment. So I just want to say thank you for that, and it's nice to hear everyone's talking about it.
Oh, thank you. I'm so glad. I'm so glad that, guys. So I also feel that the difference that you guys can make is by maybe organizing a blood drive. I mean, I'm not sure how many people is actually working in your different organizations, or if you can just go out there and, do your, but it doesn't have to be platelets, it doesn't have to be plasma that takes so long. But I mean, 10, 15 minutes, let's say 20 minutes out of your day, just to give somebody else a second chance. I mean, that's, yeah.
Um,
Agree. Thank you. Thank you, Lorraine. Sorry, we have another question. Why is the donation of platelets and plasma never mentioned when you're going to donate? Because I feel like it will make a huge difference to still get plasma or platelets. You can donate those a lot of times in a
Yeah.
year.
It's just because I don't know where the person normally donates, but the machines that they use for platelets and plasma, it cannot be moved to like your mobile sites, the ones in the shopping centers and that. So normally we ask the staff, please mention it to staff, especially to people that can't donate or that's interested. They're supposed to have pamphlets and so on all our donor or blood drives. But yeah, people tend to just sort of like forget. But that's why we take all opportunities when people ask us to come and discuss or educate or do anything on blood donation. So I'll take the messages back, the question back to say we need to do more advertising with plasma and platelets.
Mhm. Thank you. And we have, let me just quickly run to Facebook as well. We have a comment on Facebook. I'm a blood donor. I would love to donate more than just blood. I sometimes have an iron issue and get 10 back. To platelets and plasma require one to have sufficient iron levels.
So we normally advise you that if your iron is just a little bit low, not too low, because if it's extremely low that you need to go to a doctor, then obviously we won't advise you. But it actually helps you to donate plasma or platelets when your iron levels are slightly low, because remember, we don't take the red blood cells. When you donate platelets. So maybe the person needs to go into a donor center and first check, let them see how low it was. If they've deferred you, because surely if they've turned you back, they told you you can't donate for either 2 months or 3 months, then you need to maybe just wait your while the deferral period out and then go and ask them that you are interested in either donating platelets or plasma just for your iron levels to come back up again.
Yeah. Thank you. Eleni, do you want to just ask your question and elaborate more for Lorraine? I think you just unmute yourself.
Hi. Yeah, so I had two questions. So the one is why specifically are you looking for people with low iron levels? Is it because it can actually help that person that the iron kind of like regenerates, or yeah, just that was the one. I don't know if you want to answer that one first.
Yes, not necessarily that we're only looking for people with low iron. It's anybody that's interested in donating plasma or platelets, they can go forward. But we normally would say, if, like you said, if the person's iron is low, is also just to help that person to build their iron level up again. Yes.
Okay, cool. And then the second question is, so I used to donate blood. The moment I turned 16, I started donating blood. But then I got, in my 20s, I got diagnosed with a rare disease. And I've been taking things like biologic drugs and methotrexate and stuff like that. And I was just wondering, I can't donate normal blood because of that, but can you donate platelets or plasma?
So we follow the same criteria, unfortunately. Okay. Yeah.
All right. So that would cancel out because you're taking that like chemotherapy type drug. You won't be able to.
We're able to, yes.
Thank you.
Okay.
Thanks, Lindy. Okay, one last question. It's never advocated when it comes to platelets on our mobile pop-ups, where can one find out where to donate plasma and platelets?
So all our donors, most of our donor centers, but you can also, you're welcome to go to our website where you can find out. Where does the person, maybe if he can just give me the area that is in, then it would also help, but he can just go onto our website, and most of our donor centers, they do have platelets and plasma.
Okay, so she's just quickly typing to
Oh,
give us an
okay.
idea.
All right.
Randburg. Yeah.
Okay, so our Randburg, we used to have a center at the Colony, but because they're busy renovating there's a center near Monte Casino. Monte Casino, where's that now again? Yeah, I think she's talking
Fourways.
about at Fourways. What's the address now? We've got a place in Fourways, actually, a donor center where she can go and donate. I'm just trying to think now. She got me off guard. What is the address? Oh, you should have told me to come with the whole book. I can get the address for you tomorrow, Mel. And then
Yeah.
because I can't think now, Pine Slopes. Is it Pines? Yes. Is there Pine Slopes Shopping Center? They are in there. So they do platelets and plasma there.
Yes, that's the one. Sorry, I could also not remember the shopping center. Yes,
Yeah.
it's in Pine Slope. They've got a
Yes.
beautiful
Yeah.
center there, and they've got the plasma machines there.
Yes. Yeah,
Yeah.
definitely. Thank you so much.
Can I ask
Yes.
some? Ureta speaking. Is
Yes.
it okay if I ask?
Yes.
Yes. Yes, please.
From December 24, there was a big shortage suddenly for Polygam. Polygam is the only one that's the IVIG in South Africa at the moment. The others is coming like Covitro and so on. They come from, the other ones comes from Switzerland and it's very expensive. But the problem from 24, the only factory that is doing the Polygam for the people that's immune deficiency or with me with a rare disease is coming from Ndabeni in Durban. And suddenly there's a big shortage every time. So the problem is, do you think it's because the people is donating less blood, or is it in the freeze-dried process of the factory that there's a problem with Polygam? Because every single month I go now, I have to 12 days beforehand they will try to find Polygam enough for me that getting 9 bottles of 12 grams every month. So it is now, looks like it's the whole of South Africa. So I was just wondering, because people always ask me, and because I'm medical professional all these years from 1983, I always try to tell the people where's my Polygam coming from. So I was just wondering if other people also find that the antibodies process is also a problem in the factory, getting it all along to the whole of South Africa. Do you find that the people ask about it?
I haven't found it. I haven't had, is anybody, well, you guys maybe, but I have not had anybody asking.
Yeah, that's
No.
quite not. Yeah, it's quite interesting because my son is in France and he said, "Mom, I donate blood for other people like you." So it was nice to hear that he's also donating blood for other people like me, because the youngsters, they don't go and give blood so easily like the older people used to go very regularly every month or when they can. So I am just saying that it is a big, huge problem for us people that's got immune deficiencies to get the Polygam. So I hope there's a other thing that they will find, because it's every month you have a rare disease and you have the immune deficiency, but you're worried every month when you go if they will have enough for you to
Mm.
get. So I thought there will be other people as well worried about that, but I hope it's not because of the people, donating blood.
Donating. No.
Thank you.
Eh.
Can I also jump in, Soms? Hi, everybody. My name is Nomsa. Jared, I'm jumping in to actually reply to you. I feel like from what I've picked up, post-COVID, things have been totally different, more
Yes.
especially with people exposing themselves out, particularly the immunodeficiency people. Like
Yes.
the fear of catching anything is there and it exists. So it makes it a whole lot difficult to actually get blood donated. I don't know if that makes sense.
That
However,
makes
it does, right? However, we are still trying, hence the relationship now with National Blood Services, to try and advocate and get as many people to spread awareness around blood donation for you guys.
yes.
For my immunodeficiency people, because I know how difficult it is. For those who are on polygam, it's tough. And getting into a hospital and not being able to get enough blood poses
Yeah.
as a risk to your health. So
Yes.
it's a teething process. I think though post-COVID, things have never been the same. But it's a teething process. We will get there.
Thank you very much.
All right.
Thank you, Nomsa.
Thank you.
Okay, one last question before I can let you all guys leave. How do I know if I have a rare blood type? It doesn't matter if I'm not sick.
How do you find out what is your blood type? So
You're
you
if you how do I know if I have a rare blood type? And what is the rare blood type? I
So
think
the rare
basically.
blood type is AB negative. So if you want to know your blood type, you can donate blood, or the person can obviously just go and do a blood test at the doctor's to check the blood type.
Mm-hmm.
Yeah.
And sorry, this is for me now.
Okay.
Which one is the most common one?
It's O positive.
Oh, okay.
Yeah.
Okay.
Sorry. Can I ask a question, Sums?
Mm-hmm. Yes, go ahead.
Okay, Lorraine,
Yes,
sorry to
yes.
bring you under the bus right now, but I feel like this is a question you come across a lot of times. It's regarding the myths and misconceptions that
Mhm.
are around blood donation. It's a lot. And particularly, as Jared mentioned, in our community, it's really, really bad. There's always a myth or a misconception when it comes to donating blood. You do this, you cannot use somebody else's blood. The education is not there. Is there possibility that you have some material or anything that can help us mitigate these issues, the myths and the misconceptions when it comes to blood donation? Like Jared mentioned, a lot of our patients use blood and they need blood. And I feel like the awareness around the importance of a blood donation is not there. Because some of our patients,
Yes.
like Jared, they have immunodeficiencies, right? It's a
Yes.
massive, large community that they have. And then you'll have patients that have muscular diseases, but those are the patients that can genuinely donate, but they don't do it because of the misconceptions. Is there anything that you are willing to share that we can also share on our end?
I can find tomorrow I'll go and have a look and see what we can share with you guys, and I will send it to Mel.
Okay, thank you so much.
Okay.
Okay. Thank you.
Thank you very much, Soms.
Thank you all for joining, and our Facebook people as well. It's been a nice turnaround in such a short notice as well. So thank you, and thank you, Lorraine Israel, for taking time off your working hours to be
No,
with us.
I'm at home. Huh?
Thank
No,
you
it's
so
fine.
You could be
much.
It's a
making
pleasure.
dinner or watching
Yeah.
news or a
I
Netflix
had to just
program or
put
something.
I had to put myself in a small room.
Shame, Lorraine. This is our life. Hey, I mean,
Yeah,
for
this
us
is
to
our
be
life.
able to get our patients in one place for a webinar or a meeting, it always has to be the afternoons because during the days are hectic and possibly so everybody's at work, nobody's available. It's children, it's da. So that's why
Yeah.
we often opt for afternoons and evenings. So we
Okay.
apologize, but welcome
No,
to our
no,
world.
don't stress about it. No, don't stress about it. It's a pleasure, ladies. and
Thank
gents.
you.
All right.
Thank you. Take care, everyone. The recording will be available on our YouTube page as well. So if you wanna just circulate it, but you will be alerted as soon as the recording is out, and then you can just circulate it. The more awareness we can raise, the more blood donation, platelets, and plasma donations we can have as well. So thank you guys for taking the time to join in as well.
Thank you.
Okay. Thank
Bye.
you.
Thank
Mel,
you.
can we just have a
Yes.
2 minute after everybody's left?
Okay. Let me call you directly on your line.
Okay, phone me on my cell. I think that would be better. Thanks.
Okay.
Okay.
Amazing. Okay. Thank you, Chetson. Bye.
Okay. Bye.